Every year, the Malawi government allocates funds and resources to district councils to improve public service delivery. Through various development funding mechanisms such as National Budget Allocation, District Development Fund, Local Development Fund, and Constituency Development Fund, government pumps money into district councils to enhance livelihoods of Malawians through efficient public service delivery. However, on the ground, results have not been satisfactory. Public service delivery remains a challenge, and this has led to increasing poverty levels. For instance, in 2016, an audit by the Local Development Fund uncovered widespread abuse of funds in district councils, amounting to $102 million United States dollars, which Malawi government sourced from the World Bank for Masa 4 project. This money was expected to assist households that were affected by January 2015 floods and 2016 growing season drought. This is Karonga district in the northern part of Malawi. In 2017, the district council here was listed among 14 districts that abused the funds amounting to 80 million kwacha. According to an audit report by the Central Internal Audit Unit in the Ministry of Finance, Economic Planning and Development, the money abused was meant for constituency development for 2014, 2015, and 2016 financial years. The people of Mulale village in the district were affected by the mismanagement of these funds. This structure here is what is expected to be Mulale Market. The structure was supposed to cost 8 million kwacha, but it cost 12 million kwacha because of corrupt practices. The structure also delayed because the contractor left the job uncompleted after pocketing 8 million kwacha.
Msika uo ukamalizika cha ukakhala pa malo apo kwa vyaka pafupi viwiri contractor akadijewa na kwa karuta tikamanyako na kumanyako yayi so tikamba chifukwa cha masambiro akatipasa nkhongono kuti timchemeshe contractor tiwafumbe ku council akwa DC kuti ka ise ovwiri ukapasika kufumira ku council ni Christmas ya contractor
pamusika apa ikaruta 8 million nati mundu wa ntchito uti nigwirira ntchito apa kwamba nikutagwirepo ntchito cha mbona kaombe ndalama zonse mulipire zonse zirujewa 8 million pa.
The health sector too was affected in Karonga district. Here at Mulale Health Center, medical staff, guardians and patients suffered because the clinic operated for 2 years without water.
Pano pachipatala tikasangana masuzu kana ndi chomene chifukwa kukhala ni maji pachipatala pali maji ndikuti pakuba ukhondo kwene mutakakhalira kwambula maji pano pachipatala tikakhalanga umoyo uwemi yayi.
Despite the malpractices that dwindle the progress of public service delivery, the government of Malawi, in collaboration with other stakeholders, is putting effort to ensure that there's improved public service delivery. In this regard, non-governmental organizations such as Nice Trust have been working with the government to promote transparency and accountability for satisfactory public service delivery. Nice Trust found out that abuse of resources in the public service is a result of weak oversight mechanisms and limited citizenry engagement and participatory monitoring. Hence, through a 13-month project titled Strengthening Local Governance for Improved Service Delivery, Innovation and Crowdsourcing, which is funded by Tilitonsi Foundation, Nice Trust is engaging the local communities to implement mechanisms aimed at giving the citizens a sense of ownership to monitor the progress of public service delivery in the district councils.
In Mulale here we have a citizen forum which NICE has supported, and it has played a very big role in ensuring that this project of ensuring service delivery and accountability is successful. We have the representatives of Citizen Forum here. We also work with the Area Development Committee, and the members are also here. And we also have the Group Village Headman, the principal Group Village Headman for this area, GVH Mwakawanga, is also here and has been very supportive throughout the process. The project that we've been working in partnership with Tiltonse is about enhancing service delivery and accountability. So we have closely worked with the Mlale Citizen Forum. In the first place, we had to build their capacity in service charter. They had to understand the service charter, which is basically an agreement between the public service and the community on the standards of services that the community is expected to get from the public service. And in the service charter, the role of the community is also prescribed, and so the community also plays its role to ensure that the standards are accepted. In the event that the public service is not delivering the services to the expected, to the prescribed standards, they have been mobilized to be able to demand the service providers to account for their performance. And in Mlale here, there are examples of cases where the communities have demanded accountability from service providers, and we have seen it working successfully.
NICE Trust also facilitates public awareness and knowledge among the citizens on service standards and service charter. In the process, service charter committees have been formed in hospitals as well as in the villages. Here at Karonga District Hospital, service charter has enabled the communities to participate in the affairs of the hospital. The hospital has therefore translated the charter into Chichewa, Tumbuka, and Kiangonde languages.
We introduced via the service charter. Now we have disseminated information to the people. They now know that whenever they have a complaint, they can lodge this complaint with the hospital ombudsman. So what we have seen so far is that there's been an increase in people coming to the office of the ombudsman to lodge complaints. And these complaints have been handled. Those that we can handle, that can be solved here, they have been solved. So we would attribute that to the service charter itself. Also uptake of other services like family planning. It may not be that much here at the district hospital, but in the communities, we have seen that there's an improvement in the uptake of these services. Generally, I would say there has been an increase in people seeking in the demand for service delivery. It could be because of other projects as well, right? But we know that these projects tend to complement each other. As this project is being complemented, as NICE is implementing this project, they tend to complement each other, and in the end, service delivery increases and demand also increases.
After consulting, sometimes we find that there are some challenges within the document. So the community, when suggests that on this point maybe we have to change, so we have to make sure it suits the community which we intend to serve. So that's the importance of updating it. The committee, being health care workers, we have understood our role better than before, and the community, after several consultations, we see that the community now understands the role of a patient and the role of a health worker, as well as some rights of a patient or a client and the rights of a health worker. So now we are moving towards improving the quality of our health services delivered.
Through community mobilization and crowdsourcing, NICE Trust has helped the people of Mlale to form committees that monitor and participate in the delivery of health services. Through an article that appeared in the Daily Times newspaper, the communities of Mlale demanded that water problem had to be fixed for improved health delivery. Bravo to the committee's move Mulale Healthy Clinic now has clean water.
Maji haya kwa sababu tuko kondo Chomeni. Wakati kwa fupi. Haya maji ya kumama kola no mistake yai. Ndito soda yuko kila kitu kwa Chomeni. Tukasonga Chomeni. Ni ya maji. Yai kweni solo yai.
Vuto la mazi kuzera makomiti amene ndikunena panopa ndi community mavuto amazi atani atha amazi alipo pa chipatala. Komanso chipatala panopa chinayamba chifukwa cha komiti imeneyo, chifukwa cha maphunziro a service charter.
Ndipo pa chipatala pano sono apa kuoneka makora chifukwa pali maji ukhondo uli pene papa pakuti pakusuzika yayi kuti panyake tione kuti pano pali nyasi panyake tiwe cha kusuza paliji chifukwa cha kuti maji yali pafupi.
The project has reached other areas such as Malongo, which is under traditional authority Wasambo in the district. The people of Malongo are proud of the project and are spreading the knowledge so that people should understand that they deserve better public services. The community is also sensitized on the need to take part and monitor development projects happening in their respective areas, saying part of the funds used is taxpayers' money.
Ise tikophala kuti tivenge kuli ba haki au bakuonanga mankhwala omwe akuziranga pa chipatala komiti ya haki. Komiti ya haki ila pala mkhwala ukwiza iwo bakumanya kuti mkhwala withu wiza unandi mwakuti. Ndipo mkhwala ungatola mtunda panyake mwezi kuti umale. Sono vantu bahaki bala na vantu bamkaya bakulana chimozi. Bahaki bakuyamaso pa badokotala bakuonanga kuti badokotala vitu ava bangasanganga mpata wakuti bangasobeshanga mankhwala cha. Oloso vantu bala bakukaya bala pala bamuona waka kuti panya dokotala wayeya ka botolo ka mkhwala bakuna mfumba kuti mwayeya vichu ba dokotala. Vantu bala olo bahaki bala bakuna kumfumba yula pala osanga ndi mkhwala mbwenu report ku mafumu gapange report ku ADC kuti kuno kwachitika vyakuti ni mtu kwalimbikisia kwa palia kuti aliyose jiso livenge pabanyithu abo bakugwira ntchito kuti baleke kuti timbanizira moyo witu.
Kuno kuchirumba nkhani iyo ikasuja Chomeni kuti ku Chirumba Rural Hospital kukawa kuti kuli nyumba zauti zikazengeka mu 2014 kweni zikakharanga waka kuti vantu mastafu akanjira mocha. Kweni chifukwa cha kusankha kwa komiti hii na kupanga kafufuku na kalondolondo apa na apa kwa sono chasanga kuti nyumba zira sono va ntchito vanjiringemo. Kweniso vantu vakumanya za ufuru wao umwangatira kula kuchipatara na hivyo vangachita na hivyo vukwenerera kuti vivasange usange vasuzika kutoka kuchipatara.
For service delivery to meet the required standards, traditional leaders play a key role. However, traditional leaders too have been expressing their worry with the way the funds have been abused in the district councils. But now they feel the project has enabled citizens to take part in decision-making processes as regards to developmental participation and the eradication of corrupt practices.
Kumulale kuti chitukuko chifume ku national ati amugwire chituko chakuti panyengo ye mulale yukana ta chitukuko tipembeteka noti kuti muti mugwire chitukuko cha isi tipembe ichi tusuzika ise noti kuti imu muti musuzika uko amugwire ntchito yakuti tingagwira cha but chitukuko chira but chichawaka tusuzika ise kuno tusuzika na chitukuko chira tusuzika na chitukuko chinyake uko bate mugwire chitukuko cha madazi akuno kumulale kwizira kwa senior jive chama tikukana tikuti chitukuko ichi tukumba chitukuko chakuti ichi tusuzika nacho icho sono kuno turubenuka chonde bati tonse mumpempani gwirani manja na nice gwirana visambizo hivi bakutuli bakutifuira kwizira kwa imwe nani ningayoya cha chiuta asachirepo kuvisambizo vihi ivi imwe na naye sichiuta asajirepo kuti mteuli mwenye pamoja.
People of Karonga have now a sigh of relief as Tilitonse Foundation funded NICE Trust project to a tune of 89,000 euros to help in implementation of strengthening local governance for improved service delivery, innovation, and crowdsourcing project.
The project is going towards the end of its implementation phase. We are in the last quarter of the agreement that we had, but so far we've seen a number of good developments that have come out. For example, here in Lilongwe, there was an issue in Mgona area where the water kiosks were closed by the authorities without the involvement or engagement with the communities. But through the mobilization of this project, the communities went and engaged the service providers, and now the water kiosks were reopened and people are now accessing water from the various water points in Ngona area. The second one is in Luchenza, where we had the communities engaging the council, the Luchenza Town Council, to develop a service charter to agree on minimum standards that the communities should expect from the council. And this, I'm glad to say that it has been achieved. The service charter is operational. Again, in Karonga, we had NICE engaging the health sector to come up with the service charter for some of the health facilities in the district. And this has been achieved. So you can see some pockets of results that are coming out from this project, though the project has not yet been completed.
True democracy and good governance is achieved when the public is taking part in decision making and demand better services that are up to the standard. This can only be realized when the citizens work in collaboration with the government, non-government organizations, leaders, and torchbearers for the common good. As we have seen, Karonga district has shown that improved public service delivery is possible when all the parties put forth concerted effort.